everybody and welcome back. Today I'm to you guys about where I am in my nursing school timeline and when I'm planning on graduating and what I'm planning on focusing on. So I am currently in my 5th semester of nursing school. That's out of 6 semesters. I have about 7 months until I graduate, which is super exciting. I'll be graduating in spring of 2016. We're still waiting on a graduation date from the school, but we're so excited to get there and finally graduate and become nurses. This semester is my psych and community semester. So I'm doing psychiatric nursing and then community health nursing. And both of these are actually really fun and interesting. Some schools, they don't offer community health nursing. I'm actually going to be getting my public health nursing license when I graduate, which is something really awesome that my school offers. But I am... So let's see. This semester I have Monday off. Tuesday I have clinical from 8:30 a.m. to 1 p.m. Wednesday I'm doing peer nurse student advising. So basically I sit and I wait for nursing students or potential nursing students to come talk to me about getting into nursing school at my school. And then I wait and then I talk to them and I kind of give them a rundown on what it is to get in and how difficult it might be and just see if they're prepared for the challenge. On Thursdays I have clinical from 10:30 a.m. to 6:30 p.m. So that's a full 8-hour day. My other clinical is worth less units, that's why it's so short, but this one is longer. It's an 8-hour day. And that is my community nursing, so we actually are going and doing house calls at people's homes and teaching them and doing some patient teaching inside their homes and seeing the people and their families, and that's really great. On Fridays, that's my big lecture day. Most people don't have class on Fridays, however in nursing school I definitely have pretty much every semester. On Fridays I have psychiatric theory at 8 a.m. Let me tell you, that is a challenge because it's early and the teacher we have right now is a little bit boring. Let's just say that she gets off track a lot. It's hard to pay attention. I was going to maybe bring in some tips and tricks about how to work with a teacher like that. And I have, so that's 2 hours, and then I have my community theory class, which is also another 2 hours. That's going to lead us up right around to 12 o'clock. We have a half-hour break, and then I have my professional role development class. And this semester it's been pretty fun. We have 3 teachers. We're kind of splitting up the work, and we've done some really interesting projects. We're doing a project in my community clinical setting with my community group, measuring depression and hypertension. That's pretty interesting, but that's my week this semester. At the beginning of the semester, it really seemed like I almost wasn't even in school. There wasn't a lot of homework. I didn't have any papers or tests really until about a month in, and then now I'm starting to feel the heat. My nursing school, we use the ATI nursing prep for the NCLEX. Some schools use HESI. My nursing school has actually recently switched over to HESI, and I'm the last cohort doing ATI. But we have exams for that every semester, so I'm going to have a psych ATI, a community ATI, and then the predictor. And the predictor is basically a combination of everything we've learned throughout the 2.5 years of nursing school that I've been completing. And it's a 150.3-hour test where I'm going to sit down on a computer and answer 150 questions and hopefully pass. Because if you don't pass, you have to take it again until you do pass, or else you can't move on to the next semester. That never really happens to anybody, however, I would not like to be the first. And then I'm going to have a community final and a psych final, so that's going to be so much fun. Really kind of crunching down here at the end of the semester. We have my last final date's on December 10th, so that's pretty much exactly a month away at this point, which is pretty exciting because then it'll be Christmas time. I love Christmas. So that's what's going on right now. I am writing a 11-page paper for my community clinical, which has been a challenge. It's a long paper and it has included a lot of research, especially research on cholesterol, diabetes, and managing the symptoms of menopause, which are all diagnoses that my client has that I'm writing the paper on. So I'm trying to incorporate some of the evidence-based practice primary resources to support my ideas and what I've been doing with my clients out in the field. I don't think I filmed a video at all last semester, but last semester was my second semester of medical surgical, or med-surg, the magical world of med-surg, and I had 12-hour clinical days, 1 day a week. So Thursdays I went from, was it 6:45 a.m. to 6:45 p.m. straight. That can be a nurse's shift, 12 hours. However, nurse's shifts can also be 8 hours depending on the unit you're working on and the hospital policy. That was really interesting. I got to work in the ED several times. I started 3 IVs, yay me, and I got to float to the telemetry unit. I got to be on basic med-surg, the ED. I really wanted to be in post-op, pre-op, but the manager down there couldn't fit the students in that semester. But yeah, 12-hour days. Those were a lot. It was a lot of hard work, and care plan every week, which is something we definitely weren't used to. If you don't know what a care plan is, it's basically like you choose one patient and then you kind of write all about their diagnosis, their medications, their treatment, their interventions, their patient teaching, their labs, all these like pertinent, all this pertinent data goes into this one document. So basically you can look at it and understand what's going on with your patient. Next semester is my final semester of nursing school, and I'm so excited for that. In our final semester at my school, we're doing a preceptorship. I know some nursing schools don't do that and they just kind of send you right off, but at the beginning of this 5th semester, so in September, we fill out an application basically saying these are my top 4 choices of the units I would like to be on, and then this is the time of day I'd like to have my preceptorship. And then the preceptorship coordinator, who's a really lovely woman at our school, came in and she explained the whole process, and she then decides and finds places in hospitals where hopefully you can get your first or second choice, and she's going to find a place to put us. So I have not heard back yet. I chose pediatrics, so just acute pediatrics, pediatric ICU, ER, and post-op. Those are the 4 areas that I'm most interested in, but I definitely want to work in a pediatric hospital at some point. I'm very passionate about working with kids, and I just love the kind of environment that a pediatric hospital brings. A lot of them are teaching hospitals and learning environments, and everybody there is really wonderful. Instead of having, you know, just 2 doctors round on the patient, they have a whole team of people. There's like 10 people rounding on the same patient, including caseworkers, translators, doctors, residents, nurses. It's really just kind of an amazing experience, and also the student nurse. So you're not only getting the opinion of the doctor, but then you can also be getting the opinion of the residents. And together, they are a fabulous team at these teaching children's hospitals. So I've had such a unique and wonderful experience. I got to do that in my 3rd semester, so a year ago this time I was up at a teaching pediatric hospital, and I loved it so much. So I'm hoping, so people who got into the specific hospital, the preceptor coordinator said we might hear back by the end of November, which is this month, and I have my fingers crossed, but right now I'm just trying to focus on the other things, like getting my paper done and getting all these ATI exams out of the way. I want to do after nursing school, I want to get into a new grad program. That's something that I have a high chance of getting into. However, a lot of them here in the Bay Area are very competitive. I know Stanford has one, which would be amazing to get into. It's a year-long paid residency with like classroom aspects and orientation aspects and working in the hospital. So you're not just thrown into the hospital and like, okay, good, figure it out. You have like this team of like, you're still with this team of students, and you have like preceptors and nurses who are there to support you instead of saying, okay, just go figure this out. You're completely supported, and it just sounds like a really wonderful opportunity. I want to work in pediatrics. There are 3 peds hospitals here in the Bay Area. My boyfriend and I have considered considered like moving up to Oregon or maybe to the Midwest area. However, he just got a new job, which seems like he'll be staying in for at least 2 years, so it looks like we will be staying in the Bay Area. There are 3 children's hospitals that I could apply to and get a job at. One of the children's hospitals does have a residency program that I could potentially get into if I work really hard. A lot of these new grad programs do require interviews, so working on my interviewing skills, working on a resume, getting some volunteering in. I'm also going to start working on that over winter break. I do have the chance to become a CNA. However, I am really happy in the job I'm in now, and I can only work on weekends, and it's just working really well now, and making that transition to working as a CNA would probably be really good practice for being a nurse and getting into the hospital. However, I can't make that transition right now, maybe not until the springtime, but at that point I will be graduating within a few months once the new year comes. So very exciting to see where things are going and what's going to happen in my future. If you're in nursing school or going to be on the nursing school journey soon, good luck. Go ahead and take a look at my other videos. This is just kind of an update and see what's going on. What do I want to do in my nursing career future. So thanks for watching, and I'll see you guys next time. Bye!